Hi, I'm Carissa from Three Bridges Yoga, and today I'll be taking you through the movements that occur in the feet at the ankle joints, the movements that occur at the knee joints, and the movements that occur up at the hip joints. Now, understanding how the body was designed to function and move is super important in keeping your body safe through your yoga practice. Now, all of our movement terminology comes from the perspective of Western anatomical position, which is actually our Tadasana, our mountain pose, the foundation, one of the foundational postures in our yoga practice. So let's start down at the feet. The first movement is dorsiflexion, and that happens when you pull the toes back in the direction of the body. So you're shortening the angle between the top of the foot and the shin bone. Plantar flexion, on the other hand, is when you pull your toes down. So you're increasing the angle between the top of the foot and the shin bone. Dorsiflexion is often termed flexing the foot, and then plantar flexion is often referred to as pointing. So we have dorsiflexion in poses such as downward facing dog, and plantar flexion in poses such as upward facing dog. Now, the other two movements that happen in the feet are eversion and inversion. Eversion is when we roll weight to the inner edges of the feet. So the outer edges lift and the soles of the feet actually fan to face out. Inversion is when you roll weight to the outer edges of the feet. So the soles of the feet lift to face in towards the midline of the body. So not a whole lot of eversion found in our yoga practice, but it is done in shoulder stand pose. Inversion, on the other hand, is found quite frequently, especially in a lot of our standing poses. Think warrior two, triangle pose. Anytime we're really working to anchor ground through the outer edge of the back foot, right, that's creating some inversion in the foot. Now, those are the four movements in the feet. As we make our way up to the knee is a pretty basic hinge joint. So just like the hinge on the door, it was meant to swing only two ways, and that's flexion and extension. So knee extension is found whenever the leg is straight. So when you're in mountain pose, your knees are extended. Flexion, on the other hand, is when you bend the knee. So you're shortening the angle between the lower limb and the thigh. So knee flexion can be done in combination with some other movements. So you could have the knee lifted in front of the chest. As long as it's bent, it's still knee flexion. Whenever you straighten it, it's still knee extension. So it really doesn't matter what position the leg is in. When the knee is bent, it's flexed. When it's straight, it's extended. Now, a key point I like to make about the knee comes with tree pose. So whenever you lift the foot to set it to the inside of the standing leg, sometimes it feels pretty natural to let the arch of the foot rest right on the knee joint. Now, it's important to realize that although the knee does have some give medially, so in towards the body, and laterally, it wasn't designed to function that way. So by placing the arch of the foot directly on the knee joint, you're putting unnecessary lateral pressure on that joint. So that's why it's really important you're setting the foot either somewhere below the knee or somewhere above the knee to make sure that you don't have that unnecessary pressure there. Now, another pose where the knee can be really tricky is warrior two. So a lot of times in warrior two, the knee has a tendency to want to cave in. So again, this motion, right, isn't restricted by the body, but at the same time, it wasn't designed to move that way. So really important to check in and make sure that your knee is pointing straight forward to keep your knee safe, just true knee flexion. As we work up to the leg, we get to the hip, which is a little bit more complex. Now, the hip is a ball and socket joint. The head of the femur, the thigh bone, creates the ball, and the acetabulum, which is the socket of the hip, those come together to form this ball and socket joint. Now, there's a lot more give in this joint, so it has a lot more movement. Just like the knee, we can flex and extend at the hip. Now, hip flexion is shortening the angle between the thigh and the torso. So from anatomical position, flexion comes whenever you're shortening an angle. So it doesn't matter where the joint is. So hip flexion, thigh coming up towards the torso. And then hip extension, you're sending your thigh back away from the torso. So here you're increasing the angle, right, between the torso and the thigh. So hip flexion, hip extension. Lateral rotation is also referred to as external rotation. Now, when the feet are firmly planted on the floor and the leg is straight, It's nearly impossible to externally rotate your hip without turning your toes out. So external rotation actually looks like this when the toes turn out to the side. So even though the toes are turning out, the movement is essentially coming up from the hip joint. This is external rotation. Internal rotation, the opposite, right? The toes are turning in. And this is when the leg is straight and the foot is planted to the floor. So you have toes in, internal rotation, toes out, external rotation. So again, take Warrior 2 for your example. In Warrior 2, right, you have external rotation happening in your hip joint, in the front leg, and then there's slight internal rotation happening in the back leg. Toes determine the position of the hip. That's why it's really important, folks, when you're in Warrior 1, that you're not forcing the hip forward when the toes are turned way out to the side. So if you're in a Warrior 1 pose and those back toes are turned way out to the side, by forcing the hip forward, again, you're not leading with the heel or the toes. Instead, you're putting unnecessary pressure on your knee and your ankle. So even just standing in mountain pose and seeing what that feels like in your body, external and internal rotation, will give you a better sense of how to use that movement within your yoga poses. Now external rotation, again, just like the knee, can take place in any form. So knee is lifted, external rotation, knee goes out to the side. But the movement is still originating from your hip. You can do the same thing with a straight leg. It's still external rotation. So we have flexion, extension, external rotation, internal rotation, and now we have abduction. Abduction is when the leg comes straight out away from midline. So true abduction, toes would be pointing straight ahead. If you were to add in some external rotation, the toes would then spiral up. So here you have abduction with some external rotation. Adduction is the coming back in. So you have ab away, and then add, you're coming back into the body. Abduction, adduction. And the last movement is called circumduction. So it's actually a combination of flexion, extension, abduction, and adduction. So it's all of those movements combined into one. That's your circumduction. So just to take a quick look, we'll do a knee down lunge. I feel like that reflects a lot of the movements that happen in the body from the ground to the waist. So if you take a step back and drop the back knee, you can feel these different movements in your own body. So back toes are untucked. So here you have dorsiflexion in the front foot, knee flexion in the front knee, hip flexion in the front hip. You have hip extension through the back hip because you're increasing the angle between thigh and torso. You have knee flexion in the back knee, even if it's just slight. And then you have plantar flexion in that back foot when the toes are down. So a lot of the movements can be found right here in your knee down lunge. So it's really important, once you understand how the body was designed to function and move, you'll be able to move with a lot more fluidity. You'll find a lot more stability, and with stability we know comes ease. So I thank you for watching. Namaste.